Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, my name is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut, and I'll be your host for this episode of the Connecticut eHealth Podcast. Today's guest is Jenn Searls. Jenn is the Executive Director of Connie, our state's health information exchange. I've known Jenn for over 10 years, ever since her time at ProHealth Physicians, and I'm going to have her share a little bit more about her experience and what brought her to the role of the Executive Director of Connie. So Jenn, welcome to today's show, and we're so happy that you're here to join us.
Thanks, Tom. I am really pleased to be here and excited to share with you all about Connie and the progress we've made.
So tell us a little bit about your background and what kind of a little bit about your journey about how you ended up in this role.
Thank you. I'm a Connecticut native, actually. Grew up in Glastonbury, Connecticut, left for a few years, went to Richmond, Virginia for undergrad, and then lived in Pittsburgh for a number of years where I started in my healthcare career. I have a master's in health administration and started off in my career doing EMR and systems implementation for a healthcare organization. Ended up back in Connecticut a number of years ago, working with Pri-Med down on the coast and the group of physicians there, and then went to ProHealth Physicians and really grew up quite a bit in terms of my healthcare IT background and expertise. Ended up working at ProHealth for a number of years, bringing them live on an electronic medical record and taking them through PCMH certification. So after that, ended up going to what is now called Sohn Health, but previous to that was Soho Health, and before that was called St. Francis Healthcare Partners. So have had a number of years in healthcare IT, not interoperability per se or HIE, but certainly healthcare IT in Connecticut. And so I had this opportunity to at least find out more about the health information exchange last summer. And candidly, didn't think I was a great candidate for the role. I remember going to the selection committee and saying, I don't think I'm the right person for this role. I don't have any interoperability experience. I'm not an engineer. I don't know coding. I'm not sure I'm the right person for you, but what I do know is I do know provider side, the provider side of healthcare, and I do know systems implementation, and perhaps there's someone with an operations background can be helpful in this role. And so here I am now.
So, and I've known Jenn since her days in ProHealth, and actually also in her roles at St. Francis and St. Francis Care Partners, et cetera. And I would say you're the perfect person for the role because you do actually know enough about health IT and how it works. But really also what you do know is you know how to help organizations collectively make decisions and move forward. And we're really at a very interesting time in Connie's sort of trajectory. And I think that you're really good for getting this going. We're actually in a forward moving place. So for those that are not very familiar with health information exchange, could you walk through us what it exactly is? You know, the noun part and the verb part.
Yeah, so maybe I can do it through the illustration, maybe through a story. And I think it's a story that I like to tell quite often about Brenda and her mom. And Tom, you've probably heard this story before, and you at least know Brenda for sure. But if we take Brenda and her mom, Brenda is the adult caregiver for her mother. Her mother lives independently, but Brenda is there as her main caregiver. And a couple of years back, Brenda's mom developed what I think both her PCP and urgent care physician thought was pneumonia. So she was sent home with some meds, with with some instructions to rest, drink plenty of fluids and the like. She didn't seem to be improving. And one day Brenda went to go and check on her mother and found her lying on her couch, very lethargic, not feeling well, ankle swollen. Brenda got her in her car as quickly as she possibly could, drove pell-mell to get to the nearest emergency department. And once there, the emergency department staff, as they would do, said, what are her meds? What's her past medical history? What are her allergies? Those kinds of things. And Brenda, sort of in her sort of state said, I don't know, but her PCP is right here on your medical campus. Just look in his EMR and you should have all that information. And because you've been in this situation before and you've been in healthcare for a while, that in this case, the physician was not on the same EMR and there was no way for that ED staff to be able to go in there and check all of the relevant information that Brenda's mom had in her medical record. Now, in the end, Brenda's mom ended up having open heart surgery and is fine and recovered and everything is great. But I think when you think about a health information exchange, it is an organization that provides the tools and technologies to allow for secure clinical data exchange. And so that a situation like what happened with Brenda's mom doesn't need to happen because the staff at the emergency room have access to the data from Brenda's chart so that then they're able to more quickly and more efficiently provide care to the patient in front of them. So that's really all a health information exchange is. It is an organization designed and developed to be able to securely exchange clinical information.
And that's a wonderful story about what we can do to improve care, because I think that there are plenty of experiences, and I can share multiple ones from my own past, where having access to data, in the right format and the right time is really critical. And so can you walk through a little bit more what you think the types of benefits might come to Connecticut citizens and providers by Connie, by having the health information exchange that's kind of just in its, I would say, little bit beyond its neonatal stage. It's really kind of in its infancy now.
Agreed. So ultimately, Connie was built to enable and enhance the health and well-being of the residents of the state of Connecticut. So it's a pretty broad mandate there. But that goes for everything from making sure that we can eliminate duplicative testing, right? So if I get a CT scan at one organization, there's no need for a repeat of that CT scan, right? That contributes to better patient care, higher patient satisfaction, lower overall total medical cost, and hopefully a reduction in any potential errors that could happen when we're all able to share the same data. So you start to see examples of that, or being able to provide immunization data at the point of care for providers, or claims data, maybe even at the point of care for providers. So very often what you see in healthcare, and you know this from your experience, so very often we see a wealth of data and information sort of siloed in various organizations, and they're not shared. And so you have clinical data, you have claims data, you have social determinants data, you have behavioral health data, you have dental data. All of that, when you put it all together, goes into the health and well-being of our state citizens. When it's kept in separate silos, it's very hard to get that together so that we can provide the best care for patients. So ultimately, what I see as the vision for us is to be able to bring that 360 view of the patient and all of the facets of the patient to bear for their benefit and for their providers' benefit, so that we provide the best care for patients, right? I think if I can take a little aside, one of the things that's a bit unique about Connecticut and the way our legislation was written to set up Connie is we have always contemplated that patients are going to have access to the data that's in Connie. And I think that's so important and so relevant. And I am looking forward to the day when we're able to provide patients with that access so that they can see the information that's there, so that, again, Jenn gets a CT scan over here, she can bring those results with her to the next provider and be able to share them and see them without having to repeat that test.
I think that having patients have access is going to be one of the things that engages them in their care and allows them to really become a partner in the team that provides care. So I think as a primary care clinician, I've always believed that the patient and their family are as much part of the team as anybody else. And in fact, probably I would argue, the most important part of the team. So I think that it's wonderful that they'll be able to have access to that data. They are having much more access to electronic healthcare data now through some of the federal legislation that has permitted access. So I think it'd be wonderful that Connecticut's HIE will actually provide access to data as well to patients. Can you walk through for us a little bit about how Connie got set up and, its timeline and where it kind of stands? Where is it actually situated now in time?
Yeah. So the legislation that mandated the development of Connie, I believe, was passed in 2017, was the original legislation. By 2019, Connie had become incorporated as an organization. And by 2020, we were developing the board of directors. So Connie is an independent, not-for-profit organization. And I think it's important to point that out. We're not a state agency, so we're not of the state. We were mandated by legislation of the state, but we are not a state agency. We're also a neutral and trusted entity, and we take those sort of two philosophies or two principles really to heart. Neutral meaning we are not here for the benefit of any one organization. So I don't benefit a state agency over hospital systems or hospital systems over provider organizations or provider organizations over patients. Really, I'm supposed to be that neutral convener of data for all of our benefits and specifically for the health and well-being of our state citizens. On top of that, being trusted, we have a common data sharing framework that all organizations who sign on to share and participate in Connie agree to the common rules of the road. And we, most of the stakeholders who sign on to that common shared framework have a voice within Connie's governance. So when you look at our board of directors as an example, we have a patient advocate, we have someone who represents hospitals, we have someone who represents the insurance companies, we have someone who represents state agencies, we have a physician. I am definitely forgetting members of the board on there, but my point is really that we have a group of stakeholders across the healthcare continuum that have a voice in how Connie is built and has been created. So in 2020, that board was stood up. They started meeting to develop some of the key governing principles of Connie. Towards the end of 2020, I came on board as the executive director, and we brought Michelle Pulick on as our COO. So we started off with 2 employees by the end of the year. And by 2021, we had been deemed what's called operational by the Office of Health Strategy. And why that's important for Connie is that the mandate, our enabling legislation, requires that once Connie has been deemed operational, hospitals and labs have 1 year to get connected to Connie, and all other healthcare providers have 2 years to get connected to Connie. So that mandate is really important because it helps for any organization that might not be sort of at the forefront of wanting to share data. The mandate sort of makes it a requirement to be connected and to be sharing data so that we can get to that ultimate goal of being able to provide a complete patient record for the citizens of the state of Connecticut. So we were deemed operational in 2021, and we started collecting data. And so what we have now, I just provided a report to the Health IT Council. We have about 1.5 million patients in Connie. We are receiving somewhere in the neighborhood of about 1.4 million ADT messages a week. And an ADT message is an admit, discharge, and transfer message. It's a key message when a patient is admitted or discharged from a hospital. That is a key message that we can share with, let's say, a primary care physician such as yourself, right? So Jenn was in the hospital over the weekend. I can share that information with you so that you can do the next appropriate step in taking care of me when I get out of the hospital. We have about, as I said, we're getting about 1.4 million ADT messages a week from acute care hospitals in the state. We have about 177,000 labs in Connie, about 64,000 continuity of care documents, which are sort of snapshots of a patient and their medical care in Connie. And that all represents about 20,000 providers in the state of Connecticut. And a number that I'm really proud of is we have about 1,400 patients who have opted out of Connie. And so what that means is they have gone to our website and they have said, I'm not interested in participating in data sharing in Connie. And that I'm very proud of that number, because it feels very important to me to be able to, for some of our key stakeholders, give them the opportunity in the agency to participate in data sharing or not, as they are comfortable with it. My hope is that over time, as folks understand the benefit of data sharing through Connie, some of these folks will come back in and change their decision for data sharing. But it feels important to me that we're giving Connecticut residents the opportunity to opt out if they're not comfortable with data sharing. And I'll stop there because I could probably keep going with those stats.
And those are wonderful stats, actually, because they represent what I would kind of consider almost the Tesla model, 0 to 60 in 2.6 seconds, knowing what I know about what's happened in health information exchange in Connecticut. The empowerment of patients is a very important principle. And I know that, the concept of the patient as the North Star has really been sort of the guiding principle that even informed what Connie was supposed to do when it started to actually exchange data. And I think your observation that allowing patients the agency to actually opt out when they're not comfortable and opt in when they are is actually a really important thing. But I do want to have you kind of share a little bit about how patient empanelment occurs, because I know that that's an important way that we make sure that the right information makes it to only the right people. And I think that that's another way of helping people really understand how carefully we're taking the transfer of health information between providers into consideration.
That is a great point. And thanks for bringing that up. Yes, absolutely. So empanelment Connie is a panel-based HIE, if that makes any sense. But the idea is that organizations that connect to Connie have to provide us both their patient panel, or the demographic information for their patients, as well as clinical information. And the reason the patient panel is so important is it serves two main purposes. The first and almost most important is it allows us to understand who has the active relationship with the patient. So for example, Tom, I am not one of your patients, right? I see Alina DeBrita with DeBrita Family Medicine in Avon. She is my primary care physician. So she sends in a panel, it has my data. And she lets Connie know Jenn is my patient. And that means that within Connie, in our care team widget, for lack of a better word, or in our care team screen, when you look up Jenn Searls in Connie, you will be able to see that Jenn is a patient of Alina DeBrita's, and Jenn is a patient of Renee Cortland at Starling Physicians, as an example. Jenn is not a patient of Tom Agresta's. And so when an ADT message comes in, or a CCD message comes in, or any other kind of information comes in to me, you do not have access to that information because you are not part of my care team. You have not told us that there is a relationship that you have with me as a provider. And so that is how we make sure that the information we have gets funneled to the right care team and the right providers, and only to those providers that should be looking at your data and my information. So we do that. And as I said, the second reason is really the care team. And what we have heard from our partner HIEs in other states is that care team is so important if you're at a hospital for understanding who Jenn's PCP is, so that as I'm doing discharge planning, as I'm wanting to follow up on care, I have a sense of who makes up that care team for Jenn. And that could be everything from, Jenn happens to be part of a diabetes management program at Sohn Health, for example. And so she has a care manager there who's also taking care of her. And being able to view and present that is all the purpose of that empanelment use case. So it helps us maintain security, and it helps us provide a view into the care team for other treating providers who have access to Jenn's record.
And that's wonderful. And I think that that's a really important distinction that not all HIEs kind of follow. And I wonder if you could kind of walk through where we are in terms of the sort of the next steps, where do you kind of see the next set of opportunities that Connie's kind of working on, besides kind of transferring CCDAs and ADT messages? I know there's some really interesting and wonderful plans for the next year to two.
Yeah, so we will continue to work on getting organizations onboarded onto Connie, right? So our hospitals and labs are sort of paramount because they've got until May of 2022 to make sure they're connected to Connie and providing the appropriate information into Connie. And then certainly making sure that we can get our all other providers also onboarded and connected into Connie. So just the general onboarding will continue to be a big focus for us in the next year. But we also, it's going to be important for us to be sustainable. And by sustainable, we have started with federal funds, and we will be getting state and federal funds this year as well. But it's going to be important for us to be developing the tools and the services that are of value to organizations. And so there is that people are willing and able to be able to fund us so that we can continue providing these valuable services. So we will be working through some pilots that we have this year around image exchange. So it's one thing to be able to look into Connie and say, oh, great, Jenn had a CT scan or Jenn had an X-ray. It's another thing to be able to then click on a link and actually see the CT scan and actually see the X-ray images there, right? That really augments the information that you can glean from Jenn's medical information in there. So we're going to be piloting with a couple of organizations, getting those images into Connie and being able to share them and making sure that we've got them implemented in the right way. We also, in the state of Connecticut, as in most states, you are required to check the prescription monitoring program requires you to check as you're prescribing controlled substances. And so for those providers who are logged into Connie, we want to be able to give them the same ability to download or to view a NARCS report as they have today through the Department of Consumer Protection's website to check that. So integrating that information or the viewer into Connie is going to be part of our work this year. We have kicked off, and I'm excited about this work. We are going to be working with a group to help develop the best possible medication history. And Tom, I know you know a lot about this work from having helped chair this work under the Health IT Advisory Council. But we have this great set of requirements around what the best possible medication history could be in Connie. And we've taken it now and are trying to figure out how we operationalize that for the benefit of providers and patients in Connie. So that will be starting with the data that we're already getting, the medication data we're already getting, and being able to present it in a way that makes the most sense and is the most useful for both providers and patients as they get access to that. And I'm looking forward to seeing how that develops as we move forward within Connie.
And that's certainly something that I know is going to be actually something that a lot of HIEs, or I should say no HIE, is really tackled well. So this is going to be an opportunity for Connecticut to really stand out. And I applaud your tackling this and really moving forward there, because I think it really can help providers. So go ahead and tell us more about what you're doing.
Yeah, so then some enhancements to patient consent. We today restrict the data that can be shared within Connie. There are certain sets of data that we need to have affirmative patient consent, or we believe we've set up our consent policy to require affirmative consent. So being able to roll out a tool that will help both providers when they're talking to patients get that consent and register it in our system, as well as ultimately being providing a way for patients to be able to provide affirmative consent. I'm looking forward to sort of those enhancements, because today with Connie, it's an either you're in or you're out kind of scenario. So you either opt into data sharing, you're either opt out, or your data is shared. So I want to be able to provide some more granularity, as well as also looking at developing a provider directory. Longer term, we are looking at a couple of things. I would really like to incorporate dental data into Connie. I think that there is a case to be made for oral health and the impact of oral health on clinical outcomes, as well as potentially looking at clinical outcomes on oral health. So being able to incorporate dental data into Connie so that you can, again, get that full view of a patient to be able to provide better care. we know there's a lot of work happening in the state around social determinants of health, and we know there are social determinants platforms coming into the state. I'm concerned from a Connie perspective that we may end up in the same way as we did with EMRs, where everybody sort of retreats to their EMRs and data is siloed. And I think there's a role for Connie to play to be sort of the convener of that kind of data and information, right? So if you want to use your platform, Tom, and Dr. DeBrito wants to use her platform, fine. But somewhere Connie should be able to understand the social determinant assessments you've done on a patient, and then the referrals that have been made for that patient, right? So that when you see that same patient, you are aware that somebody has already done maybe a homelessness screening or a food insecurity screening, and someone has already gotten Meals on Wheels or referred this patient to a housing coordinator for help with their homelessness situation. So we think it's going to be important for us to figure out how we navigate and provide that sort of, I use the word convener, I'm not sure it's the right word, but that convener of that data for everyone to be able to share. And then building on that image exchange workflow and developing an emergent workflow for our partners at the Connecticut Stroke Advisory Council. And so this is really being able to provide an emergent workflow for those smaller hospitals or institutions where they may not have a certified stroke they may not be a certified stroke center, but can we share the images so that as a patient is en route to a stroke center, we're sharing images with the providers that are there so that we can make immediate decisions for those patients. And then just one last sort of plug or thing to think about is ECQMs or clinical quality measures. Being able to take this data then and being able to provide some analytics on how are we doing from a quality perspective in taking care of our patients are some of the use cases we've got on the docket to at least investigate in 2022.
And I know that's quite a handful to tackle, but I also know that there's really quite a few people working on it. We're going to take a few moments to take a break, and we'll be right back. We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie, please visit conniect.org or go to the show notes from today's episode. So Jenn, as we return to our conversation, you've raised some really interesting and I would say optimistic opportunities for us in Connecticut. I'm really excited for the future. Can you comment though on how Connie is going to act as a convener and pull data together and interact with the currently existing health information exchanges that occur either through a vendor-based product or through outside exchanges or that are occurring in Connecticut already, and how will it facilitate those things? Because as you know, it's a complicated space, but I think there's a really wonderful opportunity for Connie to play that convener role.
Yeah, that's a great question. So when Connie was first contemplated, and you often hear this when we talk about Connie aims to be a network of networks, right? So our goal is not to rip things out that are working in other places and put Connie in its place. But where there are networks already existing, we see our role as collaborating with and connecting to those existing networks to make that so that we can continue to share, right? At the end of the day, we believe that our role is really to be almost a health data utility where we have this data and it is accessible for the benefit of patients. So we are not looking to rip anything out and start over again. That said, a number of we still have silos, right? Even though we have these other HIEs, even though we have maybe these EMR-based networks, there are still silos and there are still pockets of healthcare that are not connected in there. And this is one of the areas where, as I came from the provider side, I had my eyes opened to the world of healthcare that is not happening in those existing systems. And the ability for us to be able to connect is exactly where Connie is, right? We're not for profit. We are not here. Again, we are neutral and trusted. And so there's there is sort of a comfort in being able to work with Connie and say, great, I can give you my data. It's going to be fine. It is for the betterment of patients in the state of Connecticut. And it helps eliminate some of those silos where I may not be willing to give it to another organization that's sort of competing in the same space. So I think there's that, again, the convener role that I keep referencing, that ability for Connie to just say, I'm just the neutral party here. And I really want to make sure that when you see a Connecticut resident, that you have enough data and as much data as you need to make good quality healthcare decisions in conjunction with that patient and with their family. And so our goal is to find those ways we can collaborate and work together and then make those connections so that we're doing exactly that.
That's wonderful. It occurred to me that we haven't had a conversation about how you're going to be working with the state agencies like public health and our Medicaid department. And I know that that's a major role that Connie's intending to play. And so why don't you comment a little bit about that?
Yeah, that is a great point, Tom. Thanks. We have a really close and collaborative relationship with both the Office of Health Strategy and DSS, the Department of Social Services. Both have partnered with us in developing use cases. And so we have a project now with DSS where we're going to be helping them meet their patient access and interoperability rules. So that will be helping them with providing patients the ability to see their claims information through Connie. So we're excited for that project to work with them and really help patients get access to that information, as well as providing a provider directory for DSS.
For those who don't know, DSS is the agency that provides the Medicaid services to our state, in which it accounts for, I think, 1 out of every 7 or so individuals in the state. So it's a really big role that Connie's going to play in that.
Yeah. I think it's actually more than that now, unfortunately, because of COVID, but
we'll find the correct number.
You can fact check that right after. The other thing is the Office of Health Strategy, through legislation just this past year, has a requirement for both state agencies and healthcare providers to collect race, ethnicity, and language data in a standardized way. And Connie is working with OHS to figure out the best way that we can help combine data that we may have from healthcare organizations to enhance the data that we get from state agencies. So for example, if we're getting vaccine data from a state agency, can we augment that or enhance that data with race, ethnicity, and language data so that we can make better decisions around where populations are getting vaccines and where should we be targeting our efforts, as an example. So you start to see some of this work that you can really roll out in conjunction with state agencies as we get further working with them to identify those use cases.
Wonderful. That sounds like a great move forward in our state, and I'm really excited to have those things occur. Can you share with us a little bit about how an organization comes to join Connie, so that for those that haven't yet begun that journey, what is the pathway?
Yeah, the easiest thing is go to our website, which is conniect.org.
So CONNIECT.org.
That's right. And then we've got a contact us page right at the top of the screen. You can click on, you fill out the contact form, and a member of our team will reach right back out and get you connected with the relevant account manager and or forms that you need. And then we can start you down the process. You'll get an account manager who'll walk you through this whole process, walk you through the legal documents. There's essentially 3 sort of steps to connecting to Connie. There's the legal documents, there's contributing data, and then there's accessing data. And we'll walk you through the legal and the technical pieces of it.
And of course, I think the most important part that the clinicians will want is accessing data in the right format. So this has been a very engaging and wonderful conversation, Jenn, and it's been great to chat with you. Can you offer us your vision and your words of wisdom kind of for the future? What would you like to see happen, and what kind of wisdom might you leave us with?
I heard something I would like us to get to a point in the state of Connecticut where Connie is used as a verb. And here's what I mean by that. So that maybe one of your medical students comes to you, Tom, and wants to talk a bit about a particular patient, and they say, I Connied that patient, right? Meaning I went to Connie and I looked up data and information on the patient, and then, oh, okay, they've really done their due diligence. They've not only looked in our medical records, but also gone to Connie and to see what else is available there about a patient. I would ultimately like to get to that vision of having that much value in the data and the services we provide, that people start using our name as a verb. I just heard that today and I was like, yes, that's exactly what I want for Connie. That both patients and providers really see Connie as that valuable of a resource.
I love the idea of I Connied that. It seems like we're really at a good place, Jenn.
If you had asked me in November when I joined whether I thought we would be here with 230 organizations connected, and UConn Health and Hartford Healthcare and Yale New Haven Health sharing data and information in Connie, I would have told you, that seems crazy to me. But I am so heartened by the positive reactions we get. And what I see more often from folks, and I don't know if it's the pandemic that sort of helped lead to this, is, hey, maybe we're not all as connected as we thought we were. What can we do to get connected? And Connie has come along, I think, at the right time for folks to say, yeah, we should do this. We can do this. And this is going to be good for us. That doesn't mean it doesn't come without questions and concerns and thoughts, but I feel really good about our organization, our role in really working towards enhancing the health and well-being of our state citizens. And I feel like we are going to get there this time in ways that maybe we haven't been able to do in the past. So I'm really optimistic about us being able to achieve that mission for Connie 100%.
See, I told you the right person for Connie. And with that, I think we will allow Jenn to enjoy a little bit of the success, because she's going to have to continue running tomorrow to get Connie to where it needs to be. So thank you so much for joining us.
Thank you, Tom.
As always, wishing you the best of health. Your host, Tom Agresta.